Hi guys, Dr. Jordan Axe here, and I'm going to talk about some of the biggest missing pieces when it comes for testing the thyroid. People all the time come in saying their blood work's completely normal, and they've had all the thyroid blood work done. Well, I'm telling you guys, there's a good chance if they didn't find something, they missed something. Okay, so I'm going to go over the top blood work panels that you need to run to try to figure out what is causing your thyroid problems. Okay, the standard one they're always going to run is TSH, which is good. You need that number. The problem is that only tells you, really, is only telling them if they should give you medication or not. It's not telling them what's causing it. So the first thing you need to look at is thyroid antibodies, okay? 80% of thyroid problems are an immune system disorder, and it has nothing to do with the thyroid. So stop testing the thyroid. We need to test the immune system to figure out what's causing it, okay? So that's thyroid antibodies. The second one is something called reverse T3. And that's from chronic stress in the body, and that causes you to be able to not utilize the thyroid hormone. So that's reverse T3. The other one is toxicity, specifically heavy metal toxins such as mercury, lead. You could have got a toxic exposure and not known about it. Something they really don't test for in the medical system. Why do they not test for it? Because they don't really have a treatment for it. So there'd be no point. The gold standard is you only test for things that are going to change treatment. They're either going to give you Synthroid or they're not going to give you Synthroid. If you have an autoimmune problem, an adrenal problem, they don't really have a medication for that, so they're not going to test for it. Okay? So again, testing for heavy metal toxins and essential elements is huge. And really another very important one is something called IgG. Again, most people test for an allergy panel called IgE, and that's like the pinprick where they test you for ragweed or something like that. IgG is a delayed immune reaction that takes 1 to 3 days to happen. So you could be eating something that you're allergic to, causing a thyroid problem, and it could take 3 days to happen. So you have to test IgG by blood because it can take 1 to 3 days. Okay, so those are the top things you have to look for if you want to find the root cause of all thyroid disease. So thanks for tuning in. We'll see you guys next time.